The thing that I realized, and I didn't know this at the time, I was a huge fan of Dr. Fauci, Dr. Anthony Fauci, and he's now retired. When he came on the scene in 2020, I remember I made a post on LinkedIn. If my profile was active, you could look at it, where I was like, "Wow, Dr. Fauci is here now. We're going to get all this resolved. He's the expert. He's the man. He and all of us, a lot of my physician colleagues, I got a lot of. I remember I got a lot of engagement on that post, and I didn't understand at the time. I just learned this in the last week that he actually was doing research on bioterrorism. Appropriately. He was funded to do that. He had a $30 billion budget to do that. But there were two other organizations in the U.S. The military had a $70 billion bioterrorism budget. And then there was another organization that also had a $40 billion budget that he was involved with. And so I didn't know that. I mean, I think most people didn't know that. And so all this lab leak stuff at the time, I think it made perfect sense that it was a lab leak. I'm not qualified to, state that. At the time, I said I think it is, but I didn't have the proof or the evidence that showed that it was. But now I think it's common knowledge, and I think they've pretty much stated that it is a lab leak. If it is a lab leak, then the work that was being done on this virus, at least in part, was as a bioterrorism weapon, because the money that was funding that research was coming from organizations that are researching bioterrorism. And so I think that would have been helpful to know at the time. And that's one of the reasons why he was the highest paid government official, because his salary was being drawn from 3 different sources.
Yeah. I don't know what we can do to unscramble this egg. And that's the challenge now, because as much as I can recognize and see many of the challenges and the issues we're having now, we still need a degree of trust in our system in order to have a stable society. It's we need to, because the health systems are not just about COVID-19. There are many other diseases that they are managing. How do we unscramble this egg?
We are in very, very serious trouble with that. I think integrative practitioners like myself have had a free marketing campaign called COVID-19. People are questioning everything, as they honestly should have from the very beginning. Nobody should just assume, including the doctors. We are just automatically complying, with all these recommendations. And patients are smarter than we are in many, many ways. And they should be asking questions. And they are wondering why I'm not allowed to visit my family member who's dying, in the hospital, and why we are still wearing. Literally, in the last 2 weeks, we finally got the masks off at one of my hospitals. We were wearing masks. Everybody else in the whole world was not wearing masks, but the doctors and nurses, for some reason, had to continue wearing masks. And so I think we have really done a very, very huge disservice to our healthcare system in engaging the trust of our people. And I don't know if we're ever going to recover from that, because people that discover the root cause approach want that. Why wouldn't you?
Yeah, I mean, and this is the biggest challenge that I have, is that even though I know we have to speak out to challenge stuff, and even though there are risks with doing that, I think that it is incumbent that the public knows that the system is skewed in a way that allows it to be taken advantage of. And I'm trying my best to defend good clinicians across the world who have been pulled into that trap of only looking at evidence-based medicine without actually looking at the evidence themselves with a critical eye.
Yeah.
And that's something that I don't think the general public understand. The system is based on protocols.
Right. Well, they trust us. Just like we trust professionals. Like if I go to my lawyer, if I go to my accountant, I trust them. I don't know anything about law or accounting. So when they tell me that so-and-so is A, B, and C, I believe it.